Welcome to this episode of Medicine and the Machine with my co-host Eric Topol. I'm getting to welcome Vivek Murthy. Dr. Murthy was the 19th Surgeon General, began at Harvard College and then went on to Yale for his medical school and his MBA residency at the Brigham, and then was a hospitalist there before being tapped by President Obama to become the 19th Surgeon General. He's been such a wonderful, calming, soothing voice of reason in a very unreasonable time. I want to share one anecdote, Vivek, if I may, of the first time we met. I remember seeing you in your wonderful Vice Admiral's uniform, and I knew who you were, of course, and I came over and introduced myself, and you said, Dr. Verghese, I remember seeing you when I was a medical student. And I never felt older than that moment when the Surgeon General remembered my talking to his medical school class. So anyway, it's a real treat to have you with us and to get to chat with you. How have you been, I should ask? How's life going?
Well, first of all, let me just say how excited I am to have this conversation with you and Eric. Conversations with friends are something that I appreciate now more than ever, given how this pandemic has separated us from people we care about and made it harder to see folks. So it's nice to have this conversation. And I should just say, Abraham, that not to embarrass you, but in that event I remember in medical school is when you came to give grand rounds at Yale at the Department of Medicine. And you captivated that audience in such an amazing way. And you did it with your eloquence, with your humor, with your insights. And all those years later, it has stuck with me. So it's a testament to who you are.
Much.
But to answer your question, I'm doing okay. I'm doing well. This is like everyone else. It's been a tumultuous time dealing with COVID, and there's some hardships, in the sense that, I worry about my family. My dad and my sister are still seeing patients as primary care doctors, and I worry about their exposure there in Miami, Florida, which is, a place where there's a lot of virus. I also worry about my kids. They haven't been able to see friends, and they're 4 and 2. And so my older one, Tejas, is starting pre-K 4, but he's shy, and it's harder for him to just make friends online with kids he's never met before. And so, I worry. But the good news is that we have a roof over our heads, we have food, we're healthy, and I'm grateful that the last 7 months I've been quarantining with my extended family, with my sister and my parents and my wife and our two kids and my grandmother in Miami. So it's made me grateful for a time with family.
That's wonderful. I think many of our listeners will know, but some may not, that when you were in college, you founded an organization, a nonprofit that was supporting HIV patients. And then later, I think perhaps when you were a resident or on the faculty, you began Doctors for America, which evolved into this large organization talking about healthcare reform. So I imagine that your ideas are now being very much sought out by one or both candidates as people try to formulate what's next. Maybe just one candidate, but I wonder how much you can tell us about that.
Yeah, well, I certainly have been really privileged to have had the opportunity to work on public health from a number of different angles since I was in college, and it was a journey I began with my sister, which made it particularly special. But in this sort of particular time where we're dealing with COVID, it's really interesting because it's brought together so many threads, at least for me, of work from the last 2 decades. Like certainly working on outbreaks, which is something that I worked on when I was Surgeon General. We were dealing with Ebola and Zika when I was in office. But then there are deeper challenges around our public health infrastructure and how to really come to grips with the fact that we've been struggling actually for a long time, long before this pandemic, when it comes to having adequate public health systems, adequate infrastructure, adequate workforce, and really adequate funding when it comes to public health. But that is also, I would say, really intersected deeply in a profound way with issues around mental health and emotional well-being, which have been in areas that have really captivated me over the last several years, in particular because when I was Surgeon General, I was coming to see that beneath so many of the stories I was hearing, whether it was about the opioid epidemic or violence in communities or people's struggles with depression and anxiety and chronic disease, were these threads of emotional struggle and pain. And it became very clear to me very quickly that that deeper pain that so many people are experiencing is in fact very much connected to not just their overall satisfaction and well-being, but to the physical illness that we in fact see. And so when we come to think about COVID-19, you find all of these threads intersecting. It's taken a toll on our physical and mental health. It's exposed the holes in our public health system. It's exposed the holes in our healthcare system as well. And we have an opportunity now to think about how we fill those holes, how we not just address COVID-19, but strengthen our infrastructure, our healthcare system, our public health, apparatus, as well as, frankly, our willingness to come together and to address these types of challenges. This is a moment for rebuilding and for unification. And if we approach it the right way, my hope is that we can come out stronger than before the pandemic began.
Wonderful.
I wonder, Vivek, we've dug such a deep hole, which must be unrecognizable from the experiences you had with Zika and Ebola when you were Surgeon General, which makes it all the more formidable to get out of this, to have an exit. What do you see as the prospects? You know what it would take, of how we're going to navigate through this. I know you're trying to help, hopefully, with the new leadership that we'll have. But what do you think are going to be the most important components of digging out?
Yeah, it's a great question, Eric. And, I think what we've seen with the COVID-19 response has been, it's been really unusual, that's to put it lightly. And unusual in the sense that in prior experiences, when we had a major outbreak or a pandemic, what we saw is that whether we were in Republican or Democratic administrations, we usually saw people line up behind the scientists and use science to guide their policy and decision making, as well as their messaging and communication. And the way in which we've seen COVID-19 approached from the federal level has been a stark contrast to Republican and Democratic administrations in the past. One of the greatest costs I worry about certainly is obviously the loss of life, the suffering that so many families and individuals have endured. But I also worry about the erosion, and I would say erosion is probably too light a word, but the destruction of public trust that has taken place during these last 7-8 months in particular. Because one thing I really believe is that when you're responding to a pandemic, that public trust is one of your most important assets. And you need to do everything possible to cultivate that trust, to be deserving of that trust. Because if you lose the public's trust, even when you are trying to get them to do things that could be helpful for themselves and the community, they may not do them. They may not trust, for example, that the vaccine that you have is truly safe and effective. They may not believe you when you say that masks are an important tool to help reduce spread, or that the judgment of the public health community is that we need to reduce crowd sizes. They may worry if you're accurate, in your recommendations. So you've got to cultivate that trust. And so I think any public health response to COVID-19, whether Vice President Biden serves as president, or whether President Trump has the opportunity to serve again, any effective response will require us rebuilding that trust. And the way we do that, has to start with, number one, communicating openly, clearly, and honestly with the public. It has to also include setting clear goals and timetables and deliverables, and then actually achieving those goals. It's delivering results. And we've also finally got to show that we are going to prioritize science and scientists. And that involves not just saying that we're going to do it, but actually putting scientists forward to communicate directly with the public, allowing agencies like the FDA to be independent in the guidance they issue in their decision-making, and that applies to the CDC as well. So whoever serves as president, that will have to be, I think, the most important step they take, because without that trust, you may have the best science, the best recommendations, the most effective therapeutics and vaccines, but people aren't going to follow that guidance or take those treatments or vaccines.
I must say, this is timely because just today, Eric and I published an essay in Science Translational Medicine, calling on the leadership of the CDC and the FDA to speak out, because one gets the sense that they're being reticent. And it leads me to ask you, I guess, as Surgeon General, one is shackled by the office in terms of what one can say or who one answers to. And the shackles have come off for you now, and I was glad to see you talk about the super spreader event at the White House. But I mean, how would it have been right now if you were Surgeon General? I imagine this would have been a very challenging time for you.
It would have been very challenging. Yeah. And I think, look, every government official, especially those who are in a publicly visible position, before you agree to serve, you have to know what your red lines are. What are you willing to not do? What lines are you not willing to cross, as you seek to serve in your role? And when I was serving, I was one of the reasons I was actually interested in the position of Surgeon General when they called me about it was that the Surgeon General actually has historically an independent role. The job of the Surgeon General is not to execute the political agenda of the president who appoints him or her, but it's actually to have the highest fidelity to science and the public interest. And if that involves disagreeing with your president, then that is actually what you're supposed to do. That's actually the job. And so I think that, frankly, I'm not sure how long I would have lasted in the current administration, because I know that it has been challenging for many of the public health officials there to speak openly and to speak their minds. But I think it's important to do so. There's always a calculus that public officials make. Should I stay in and try to do as much good as I can behind the scenes and prevent, even more damage from being done? Or should I speak up, knowing that that may make a difference now, but I'll likely get terminated or shoved into a closet and may not be able to make much of an impact later? And, that's a difficult decision. It's easy, I think, on the one hand, to say everybody should just, say their piece and get fired on day one. But you do need good people in there continuing to run the operation. I think where the calculus shifts, though, is if you on big issues and on too many small issues find yourself allowing mistruths and other sort of statements to continue to go by unchallenged or unaddressed, then you start to erode confidence in your institution itself, right? So in the case of the CDC, I having worked with many people in the CDC, I have great respect for the CDC and great respect for the people who work there. They have tremendous expertise. There's a reason that the CDC has been the envy of the world, for many, many years. It's not because they're perfect, but it's because they're really, really good, at what they do. And so I know that that institution has the ability to put together really good guidance and to help us figure out how to think about reopening schools and workplaces. The fact that they weren't allowed to do so, that there was pressure, from the White House to shift their guidance, to soften it, in some cases to eliminate it entirely, that is deeply disturbing. And if you allow that to continue to happen, then you actually erode people's faith in the institution itself. It becomes bigger than you as a leader. And something that I always, told my team, which I firmly believe, is when I served as Surgeon General, yes, I may have been the Surgeon General, but more importantly, we were custodians of an office that was there long before us, and an office that would be there long after us. And our job was to leave it stronger and to leave it a better platform for the Surgeon General who came after us. That meant investing in strengthening the integrity of that platform. So I do think that in cases like what we're facing right now, that the CDC director, the FDA commissioner, all of these leaders, they've got to have their red lines. They've got to know where they're willing to stand up and know what price is willing to be paid. I have no doubt that they recognize that. I'm sure they've thought about it many, 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 many times. But I do think, I worry that these institutions, the FDA, the CDC in particular, their credibility has really been challenged in the minds of a lot of people in the public. And part of what we have to do, not just for COVID, but for the future, is rebuild that faith.
Before we get to the rest of this interview with Dr. Eric Topol and Dr. Abraham Verghese, a quick word from Medscape. Remember, this and every other episode of Medicine in the Machine has an accompanying transcript available at medscape.com, where you can also find an accompanying embedded media player, allowing you to listen along as you read. You can also subscribe to this podcast right there on our site on Spotify and wherever podcasts are found. Okay, now back to the interview.
This is interesting because now we're seeing a war develop between President Trump and Tony Fauci, who many of us deeply admire, who also received a major award from the National Academy of Medicine today. At the same time, Trump is saying, I should never have listened to him and the other idiots. You know, this is an all-out assault on the science side of a pandemic. So it seems to me that this has got to be a unique situation in the history of the country, at least the history that I've ever been witness to. And you're very diplomatic in terms of describing it. But this seems like if we don't see a major change, and even now we're months away, we're looking at the third surge. It's substantial, and now with it getting colder weather, more indoors, possibly co-infection with flu. Where do you see the prospects?
Well, I'm worried too, Eric. And I'm worried about this surge. I'm worried that at a time where we need to be doubling down on precautions like mask wearing and distancing, we're not seeing our leaders lead by example, in that regard. And we're seeing controversy over things where there's actually very broad scientific agreement. So yeah, I'm deeply worried too. And I think that, look, a lot of this starts with us recognizing what's going to guide us through this. And it's going to be science. It's going to be the research that's being done. It's going to be the best practices that we've developed, from epidemic after epidemic, pandemic after pandemic that we've worked on over the years. And what we really need first and foremost is a leadership that recognizes that value of science and respects the scientists who are the conveyors of that science. And I think, I just think that what we can't have is a scenario where you have, you've got leadership, a president or other people or his staff denigrating scientific authorities, because the message it sends to the public is, gosh, you shouldn't trust scientists. And even more than that, even if you trust scientists, it leaves people with little faith that their country's going to be able to pull through. So look, I do think that we need different leadership here when it comes to part of the reason that I, am advising, Vice President Biden, and that I have been briefing him on COVID-19 since he requested that at the beginning of this pandemic, is because I really believe that that he could be that leader. I believe I've seen him in other responses, Ebola and Zika. I know that first and foremost, he's somebody who deeply believes in science and scientists. And just to, I wish I could invite you into some of these briefings so you could sort of recognize just how deeply respectful he is of science, but he also has like a very deep curiosity about science as well. Like, I remember several briefings where we were talking in great detail about the nature of, mRNA vaccines, the details of, of adenovirus vectors, and to hear him then talk about that later, publicly, it was just striking to me. This is not a man who takes these issues lightly, and he puts a lot of time into these briefings, but it's the respect he has for scientists, I think, and for science that is especially helpful. And the last thing I'll just say about, him in particular is that I've been struck by how he gravitates towards two themes that inform how he thinks about policy and how he thinks about governance. And those are the personal and the practical. So on a personal level, he's always wanting to know, like when we brief him, how does this issue specifically affect like a mom or dad who's worried about sending their kid to school? How does this issue affect a mom and pop shop that's trying to figure out how to put in place safety precautions so their employees and customers can come back? He's always bringing it back sort of to the individual, because he's always taking calls from individuals who've got his number, and he gives his number out a lot, so a lot of people call him. But so he's constantly thinking in that context. But in addition to the personal, there's the practical. He's not somebody who necessarily hangs his hat on titles and processes and such. What he instead wants is he wants to deliver results. And, whoever needs to be in the room to do that, doesn't matter what their rank, what their title, what their status is, like he wants them in the room. And so he's constantly thinking, okay, how are we going to implement that? If we had the privilege of being able to serve, like on January 20th, like what would we do? And how would we ensure that we're taking those steps to make sure schools can open? How are we making sure that we close that gap on the testing we have and the testing we need? So, I do have faith that that he would take us in a direction, the direction, frankly, that we need to go in terms of addressing this virus. But like you said, Eric, it's going to be a few more months, even if he were to win the election.
Right. And I just want to echo your points that are so valid and important. Little interactions I've had with Joe Biden, I was with the cancer program, Moonshot program, and there you could see how he was really committed. He understood, obviously, not just with his son's loss, but so much about interacting with the physicians and scientists. And he even took on Judy Faulkner of Epic regarding how important it was for people to have all their data, very practical. So, I've seen him in action, and I was very impressed with all the things where it came to a medical science interface. You have considerably more experience. I wonder if we can just get to the topic that you touched on, but in a little more depth. And the last time we spoke at any length was you were getting ready to roll out your book, your phenomenal book together. And this turned out to be a big theme in the pandemic, is the loss of togetherness and the mental health hit that we've sustained and we're still sustaining. So can you give us, I guess, a sense about how this book of yours that you've worked very hard to put together, how it turned out to dovetail so well with the experience that we've been suffering through.
Well, thanks for those kind words, Eric. And thanks for the advice you gave me actually before I rolled out my book. But I didn't think that I would write a book on the power of social connection and the consequences of loneliness. It was a book, though, informed by my experiences as Surgeon General, where I just saw in so many of the stories of people I met that this was in fact a deep issue. And what was striking to me, like Eric, was just how broadly it was being experienced. Like, when you talk about loneliness, people have they have a stereotype in their mind. They think about an older patient who's ill and who's living alone in a nursing home. They think about somebody who's older toward the end of their life, who may have lost friends, who's living by themselves. Like, these are the stereotypes we conjure. But what I was finding was that I was hearing stories of loneliness from college students who were on campuses surrounded by thousands of people. I was hearing it from moms and dads who were active in their PTA and in their neighborhoods, surrounded by people, but were still feeling really isolated and alone, particularly new parents, actually, who were feeling really alone, and they felt guilty about saying that because they thought, I should be grateful that I just had a child, but yet I'm feeling quite lonely. And just as you went down the list, I was hearing these stories of loneliness from doctors and nurses, from CEOs, from people who lived in small towns and big cities, and even from members of Congress who would tell me behind closed doors that they too were struggling with loneliness. And that just made me realize there was something much deeper happening here. Now, at the time, I had no idea when the book was being written that COVID would arrive on the scene. But what has been really striking about COVID is not only has it been extraordinarily stressful with a timeline and an end date that is uncertain, but at that time of great stress, when we would typically reach out to people in our lives to help reduce that stress, we've been placed in a situation where many people feel like they can't go visit their friends. They can't go fly and see family because of the concerns around infection spreading. And that has been a double whammy, if you will, with COVID-19. But as challenging as that is, Eric, I actually think that we have an opportunity with COVID-19 in terms of how we think about and how we address loneliness and disconnection. We can either allow this physical separation, if you will, that we're being asked to observe, to sort of develop into social separation and contribute to greater loneliness. And if we do that, and then I worry that we will incur is a social recession, if you will, marked by deepening loneliness, more distant ties, and one that will have profound consequences for our physical health, our mental health, and our productivity in the workplace and at school. And a consequence, I think, that ultimately will rival the economic headwinds we're facing. So that is one possibility. But there is actually another possibility that we can, instead of taking the path of social recession, take the path of social revival and use COVID-19 as an opportunity to step back and take stock of our lives, to ask ourselves, where do people really fit in our hierarchy, in our priorities, and to ask ourselves how we can double down on our relationships with one another. See, during the time of COVID-19, even though we can't go see people as easily, there are things we can do to strengthen our connection with one another. So, for example, just taking 15 minutes a day to reach out to people you care about, whether it's calling them on the phone or video conferencing with them, or writing someone a note just saying, hey, I'm thinking of you. I wanted you to know how you're doing. That done consistently can be a very powerful lifeline. And the reason 15 minutes alone is so powerful is that as human beings, we're hardwired to connect with one another. And when given the opportunity to do so in a meaningful, authentic way, we gain a lot of satisfaction and fulfillment from that. But the second thing we can do is actually to improve the quality of time we have with one another. And we can do that by eliminating distraction when we're talking to others. Now, as you know, I have this phone that's sitting next to me. And what I can tell you is that a lot of times when I've, over the years, been catching up with friends, I'll somehow find my hand reaching into my pocket, and all of a sudden I'll be scrolling through my inbox or looking at something on my phone and convincing myself that, yeah, I can multitask and listen at the same time. But, you know, we know from the best of science that that's not true. We actually can't multitask. We just task switch very rapidly. So then the question, what's really striking though, is if I can eliminate distraction when I'm talking to other people, I can actually create a very powerful interaction. And if you just think back to the last conversation you had, when somebody was fully present, when they were listening deeply to you, where you were able to share openly with them, and just think about how that felt, how fulfilling and renewing it was. That is the power of what conversation can be. And 5 minutes of pure focused conversation can be more powerful than 30 minutes of distracted conversation. One last thing I'll just leave you with here in terms of your question, Eric, is a third strategy I think that can help us during these times to connect. And that's to search for ways to serve one another. One of the things I realized in the writing of this book was that service is one of the greatest antidotes to loneliness we have. And even though we can't go to a soup kitchen or volunteer at an organization, at a time when so many people are struggling with the transitions from COVID and the tumultuous nature of how it's affected our lives, you can be sure that people are hurting and many people are in need of help and support. And what that means is that simply checking on a neighbor to see if they're doing okay, delivering food to a friend who might have been struggling even before the pandemic arrived, offering to virtually babysit for 5 or 10 minutes, you know, for a fellow friend who may be a parent to young children and might be struggling to telework and homeschool at the same time. These are small but powerful acts of service. And the reason that service is so powerful is because when we experience loneliness, for evolutionary reasons, we enter into a state of stress and threat. And so our attention focuses inward. We also become hyper vigilant and perceive more threat around us. But we also experience an erosion in self-esteem over time as we come to believe the reason we're lonely is that we're not likable or something is broken about us. But when we serve other people, we actually break that downward spiral of loneliness because we shift the attention from ourselves to someone else. And we also reaffirm to ourselves that we have value to bring to the world. So these are very simple ways, 15 minutes, you know, a day, eliminating distraction when we talk to others, looking for opportunities to serve one another, that we can bolster, strengthen, and deepen our connection with one another, even despite this terrible pandemic that we're in.
For our listeners, the book is Together, The Healing Power of Human Connection in a Sometimes Lonely World. And, you know, I agree with Eric that it was just prophetic that you should write something like this, you know, almost as though anticipating COVID. I must say, one of the things that really strikes me is that the isolation and solitude, the sense of loneliness is, you know, very much rampant in the medical community. You know, we worried about burnout well before COVID, but it's now really reached global proportions. And one of the lines in your book that really struck me was you talked about, you know, how being vulnerable, that there was some profound lesson in vulnerability, that it was not a, you know, you said to be real is to be vulnerable. And I think that, you know, too many of our leaders are frightened to show vulnerability. I'm talking about, in the highest offices, and yet to be vulnerable is to be human, and to accept your vulnerability is perhaps the first stage into getting some insight. Do you have some messages for our physicians on the front line? I'm thinking especially of the young residents and young hospitalists and people in the ERs in terms of their own sort of burnout and stress. I mean, everything you said is absolutely relevant, but anything else you'd like to add to that with them as your listeners?
Yeah, I'm so glad you raised this, Abraham, because one of the things that has pained me greatly about our profession of medicine, is seeing that there are so many people who enter with high ideals, the desire to serve, to relieve suffering, but then they themselves end up suffering and struggling, and then feel ashamed because of that. And that can be an extremely lonely experience. And I think many people in training have gone through that, but many people even after training experience that. And we have a culture in medicine where it's not okay to talk about how you feel if you're struggling, where somehow any struggle you may have with loneliness, with depression, anxiety, or stress is seen as evidence of weakness. Yeah, I still remember on the wards whenever somebody would run a successful code, whenever they would clinch the diagnosis and morning report, the words that would often be used was people would say, "Strong work. You did a great job." But think about that term for a minute, strong work, right? So what you're conveying to them is that they are demonstrating strength through those experiences, right? Running a good code, knowing the diagnosis, being able to cite the literature. There's nothing wrong with that. But we rarely would use such terms to describe people's humanity shining through in the context of a patient interaction. I can't remember many celebratory emails that went out congratulating a professor who had just been promoted because of his or her humanitarian work, or just frankly being a good clinician, a good doctor, right? And so if you're a trainee and you're looking at that, like, what message are you getting? You're understanding that not the stated value system of medicine, but that the lived value system of medicine is one that says success is publication, success is knowledge, success is having a name, having a reputation, like in your field. And none of those things are bad, to have a reputation or to publish and to be knowledgeable. We want those things, right, like, of our doctors, if they certainly, many of these, if they want it themselves. But what we leave out is the other half of medicine, the humanistic element of medicine, the fact that medicine is both a matter and a work of the head and the heart. But when we only reward the work of the head, then not only the work of the heart, but the pains that we experience in our heart get left behind. And so for people who are experiencing loneliness in our profession, here are a few things I want you to know. I want you to know that, number one, if you are feeling lonely, that you are not the only one, but that many of us, including myself, have struggled deeply over the years with loneliness, both during training, after training, and well before training. The second thing I want you to know, though, is because you are lonely, you are not broken. You are not deficient in some way, but you are experiencing what all of us experience at some point in our life. Just like we experience hunger or thirst when our body is lacking something it needs, we experience loneliness when we are lacking something we need, which is for our survival, which is authentic human connection. But I lastly want you to know that it doesn't have to be this way in medicine, that our culture does not have to be one that does not embrace the totality of who we are, including our flaws and our perfections, including our heart and our head. And the ability to shape that culture to be more inclusive, to be more accepting, to be more vulnerable, that depends on how all of us lead in our own way. It is not the case that just because you are in training that you cannot influence culture. I've seen with myself that some of the biggest changes we made in the hospital were because a medical student or a resident saw something that was broken and needed to be fixed, and they brought it to our attention. But I do know that if people don't step up and share their stories, if they don't take those opportunities to be vulnerable, especially people in leadership positions, that the culture won't change. And the costs of that will be tremendous, not only for the patients that we want to serve, but for the fellow clinicians and colleagues that we also need to be serving and serving well. But this is a time, look, where we have the opportunity to remake a lot of things in our country and in the world through the lens of COVID. But in medicine, I think our culture is one of them. And I think about the extraordinary sacrifices that people made throughout this COVID pandemic in our hospitals and clinics, putting often their own health and well-being on the line, operating and caring for patients without masks because they weren't available. This is not the work of weak people. This is not the work that broken people do. This is the work of heroes, of strong people, of people who know that our greatest moments are when our head and our heart fuse together, when our sense of mission is married to our knowledge, and we bring that to bear in the service of the patient in front of us. And if we can recapture that spirit now in remaking our profession into the kind, compassionate, knowledgeable force that it can be, both for patients as well as for clinicians, then we can build a profession that is truly healing in the full sense of the word. That's what I want for my friends, for my family, and for all my colleagues.
That's beautifully said, Vivek. Thank you so much. So, you've seems to me you've done so many things in your life, and you're still incredibly young. You've been a practicing internist. You've changed society with some of your early social policies and your nonprofit work. You've been Surgeon General. What's the next? I should mention author also, an incredibly beautiful book, and one that I think is so germane to our times. What is the next iteration of Vivek Murthy?
Well, first of all, thank you for those kind words, Abraham. I've been blessed in a lot of ways with opportunities. I was telling a friend the other day that when I think about my parents, or immigrant parents who came from India, left India in the 1970s, I think about the delta in their lives, where they started off and where they ended up. They started off at a really difficult place. My father in particular grew up in a small farming village. He was so poor that they didn't have money for shoes. The first time he wore any coverings on his feet were when he was 15 years old. They were also so poor that they had to keep diluting the dal, that grain that they boiled every night, until there was enough to fill the bowls of each child around the table. They were really, really poor, but somehow he made it through school, went to college, which no one had ever done in the village before, went to medical school, which was unheard of, left India, even more unheard of, and built a home and a life for himself and his family here in India with my mother, who also made an extraordinary journey. And, I think there's nothing I can do in my life that will ever achieve that delta that they achieved. It's such an extraordinary story. And it's not a unique story. It's a story of so many immigrants and others who came here maybe generations ago, but parents who grew up in humble beginnings and in their own selfless way provided the foundation for those of us who came after them to step up and take advantage of opportunities. And I say that because, when you mentioned my time serving as Surgeon General, the thing that will always remain in my mind is that moment when I was sworn in and looking at Vice President Biden, who was there, and the crowd of friends and family who had assembled, and just saying to them that there are few countries in the world where the grandson of a poor farmer from India would be asked by the president to look out for the health of the entire nation. That is a beautifully and uniquely American story, and it's one that I'm deeply grateful for. I don't know what comes next. One of the things that I've realized, and I've tried to do more and more of, Abraham and Eric, over the years, is I've tried to think less and less further down the line, to actually think more short-term than long-term. And the reason is, number one, I was never very good at coming up with 5 or 10-year plans. They never seemed to stick for some reason. Maybe I wasn't disciplined enough. I don't know. But the other thing I realized is that that I'm in a place, and have been for years in my life, where I need to continually reassess what my priorities are. And I need to ground myself in the priorities I know that are right, in a world that will often pull me to a different set of priorities. So for example, I know that people and relationships are what are most important to me. I'm somewhat embarrassed to say I haven't always led a life that has been consistent with that. I've often put work far ahead of the relationships that are most important to me. But I now know that I've done that. I now know what I want to be my priority. And so the question is, how do I best serve those relationships in my life? How do I best serve society and help create a better world for my children and for all of our children, so that the world in which they inherit will be more compassionate and kind and welcoming than perhaps what it otherwise might be. And that's kind of what I'm thinking about, is how to be of service in that way. If it turns out that part of that is, is doing something related to COVID, then maybe I'll do that. If it turns out that it's continuing to work on issues related to social connection and thinking about how to rebuild that most important foundation of society, which are our connections with one another, then that may be something I focus on as well. Likely it could be both of them, but whether that's inside or outside government, that's a story that I'm still writing. But I think, and something I always try to share with trainees, in part to remind myself of it, because I need the reminding, is that the most important thing in life is not where we're going, but it's the why. Why are we choosing to take the journey we're about to take? What priority in our life is served by it? Will we be truly better off? And then when I think about those, I think about those patients, who I cared for at the end of their life, the patients who we treated with everything we had, but there came a point where there was nothing left to give in terms of medical treatment. And instead, I remember just sitting by their bedside and often holding their hand and listening to them in those final hours. And I think about what they talked about. I'll tell you what they didn't talk about. They didn't talk about the last position they held in the workplace. They didn't talk about how big their bank accounts were, or how many followers they had on social media. But what they did talk about were their relationships, the ones that had brought them great joy, the ones they wish they had spent more time with, the ones that had broken their hearts. Even those final moments when all but the most important threads of life fall away, it's our relationships that rise to the top. And I don't want to wait until the end of my life to live a life that's consistent with that recognition, with that realization. And so that's what I want to guide me. I know it won't be perfect. I know I'll need friends and family to keep me on that path, because I do get distracted at times and veer off into focusing too much on work, or on the three things that society has told us we need to be meaningful and valuable, which is work, wealth, and which is wealth, fame, and the truth is, I know that those aren't what are meaningful. I know plenty of people who are wealthy, who are powerful, and who are famous, and who are profoundly unhappy and very alone. So that's going to be my guide, like in these coming months, and to be of service to the people I care about, be of service to society, and try to create a better world for my kids and all of our children.
Vivek, I can't think of a better sentiment on which to end. I think Eric and I are just deeply admiring of what you had to say. The rhetoric that floats around us in the blogosphere, in the Twitter sphere, in the news sphere, is so devoid of some of these wonderful emotions that you're expressing, especially the vulnerability, the compassion. So what a refreshing thing to get to speak to you. We wish you, all blessings on your journey. I'm sure there is much more to come, even though you can't quite clearly see it. I'm sure it'll be great, because it'll be influenced by these wonderful values you have. So
well, that's kind of
thank you so much.
It's kind of you, Abraham, but I do want to say on your point about the airwaves and what we're hearing on the airwaves. You're right that when we read social media, when we read blogs, when we read the paper and listen to the news, we often find a lot that agitates us and that increases our stress. But what I feel we're missing in so much of this is that powerful force of love that we have talked about before. The book I wrote was ostensibly about social connection and loneliness, but it's really a book about love, about how to recapture it, how to build a life on it, how to recognize that it's the foundation that which makes a society strong and vibrant and resilient. And the truth is, we know that when love shows up in our life, it shows up in different ways, as courage, as compassion, as kindness, as generosity, as warmth. And when we feel that, when we receive it from others and when we give it ourselves, we feel good. We feel renewed. We feel whole. That's true in medicine. It's true in all dimensions of life. But the opposite of love is not hate. The opposite of love is fear. And what we hear, unfortunately, in the news and on social media is a lot of fear. Fear that's coming across as anger, as jealousy, as rage, as insecurity, as anxiety. But it's fear. And the fundamental truth is that all of us have elements of love and fear inside us, right? I would go far as to even say that fear is the absence of that deep force of love, even though they can often seem like they're coexisting with one another. But the question that I think that we have to think about, the question that I found myself thinking about with Alice, my wife, when we found out we were pregnant with our first child, is how do we ensure that we live in a world that is grounded in love and not fear? That in those, as we think about that balance in life, how do we put our hands on the side of love and tip those scales away from fear and toward the love that we all need to nurture ourselves? And I know that no one of us can do it alone. But I remember the commitment that Alice and I made that day when we were sitting there and looking at that pregnancy test, and that was showed that we were positive with our first child, and we were so excited. But the commitment we made was that it was to ourselves do everything we could to tip those scales towards love, and to do that in how we treated people in the world, by how we chose the line of work that we engaged in, by standing up and speaking up in the public square on issues that really matter, not just for ourselves, but more importantly for others, by seeking to be of service to those around us. That's how we build a world that's more grounded in love. And I mention this because I think that that is the work of our time. That is the most important work of our generation, the generation not defined by age, but defined by spirit and by a recognition of what we need to do at this moment together to build a world that is as nurturing and as vibrant and as thriving as what I know we can build. This is not ultimately a journey to somehow become something we're not. The journey to live a more connected life that's grounded in love, compassion, and kindness is a journey to return to who we ultimately are, who we were born as. I see that in my children every day, that they are by nature loving and compassionate. All of our kids are. Doesn't mean they don't fight and scratch each other and bite each other at times. That happens too. Don't get me wrong. I still have kids. But you see their true nature is to be trusting, to be kind, to be loving. That gets, beat out of us over time. We get told that if we show too much kindness or generosity, you'll be taken advantage of. You'll be perceived as weak. You need to look out for yourself as well. Don't give too much to other people. But in our hearts, we know that in our best moments, we are operating from a place of love, kindness, and compassion. So that is our mission. I believe that our most important mission. And I think in particular for our colleagues in medicine, I feel so proud to be a part of our profession, because this is a profession that's grounded in values. We may not be perfect. We may not always get it right. We may have problems that we have to fix in our culture. But by and large, we've come together around the idea that relieving suffering matters, that serving other people is a commendable thing to do. And ultimately, we've come together around a profession that is centered around compassion, kindness, and love.
Well, thanks, Vivek. I mean, I just would want to add to Abraham's points is that you're a natural leader, you're young, and you are an activist. You started that in a very early time in your life. You had to fight the whole gun thing and become the Surgeon General. I don't know how you've weathered that storm. So we're going to be looking to you for continued leadership for decades ahead. Thanks so much for what you've done.
Well, thank you both so much. It's, like I said, a privilege to be here with friends and two people I deeply admire as leaders in our profession. So grateful for our conversation.
Likewise. Thank you, Vivek. Thanks for taking the time.
Yeah.
No problem. No, this is, I'm so glad you guys are doing these series of conversations. This is,
Yeah, we're having fun.
yeah.
And this one was really deep, and I think you're going to move a lot of people. You really are remarkably articulate, and it's great. I hope Biden will find an important place for you. We need your effort.
And that's it for this episode of Medicine and the Machine. Medicine and the Machine is produced by Medscape editor Robbie Atuma. I'm your audio engineer and audio editor and a voice here at Medscape. The hosts of this show are Dr. Eric Topol and Dr. Abraham Verghese. Remember, there's a transcript of this episode available at medscape.com. You're listening to Medicine and the Machine.